We're going to talk about pain science. And so I want to start off by kind of categorizing the two big groups of pain. So we have what's called acute pain, which is usually after a sudden injury, car accident, a surgery, something where there's some sort of wound that needs to heal. And then we have what's called chronic pain, which is usually something, or I think now it's called persistent pain, but typically chronic pain is pain that you've been experiencing for longer than 6 months. A lot of people that I work with chronic pain have been dealing with it for maybe decades. And so with chronic pain, usually chronic pain is from an old injury that never really healed properly, or it could be something that you're doing in your life, whether it's the way that you're sitting or the way that you're sleeping. A lot of times it's the way that you're moving, like regularly. For example, let's say you're squatting incorrectly and you go to the gym 3 times a week and you're always doing the same repetitive movement incorrectly. Like that might cause an issue in, maybe your hip or your back or your knee or something like that. So when you have an acute injury, your body sends you signals to tell you there is an injury in this area of the body, and that creates pain. There's inflammation because the wound is trying to heal. And so as the wound heals, usually that pain will decrease. For some people, even though the wound is healing, the pain might not go down. Of course, people have different like subjective pain levels, but in general, the pain intensity should decrease as the wound is healing. If that's not happening, it's possible that you're continuing to aggravate it with something that you're doing. For example, let's say you sprain your ankle, and instead of letting it rest, you continue to walk on it. So of course, the pain should be decreasing as time goes on, but because you're not really allowing it to heal, that pain is not really going to get better, and then the wound is really also not going to heal, or it's going to take a little bit longer than if you just rested it. So with chronic pain, it tends to be a little bit more complicated because the nervous system gets involved. So your body might be telling you that there is a painful stimulus, either somewhere where there was one or somewhere where there never was one. But your brain is interpreting that signal, right? And it's telling you there's something painful happening in this area, even if there's physically no injury. There's something called referred pain, where there's, let's say, an organ or an area of the body that might send a pain signal to another area of the body. So a very good example of this is when you have a heart attack, some people will have pain in their left arm. So there's no physical injury in your left arm, but the pain signal that you're feeling is telling you that it's in your arm, even though it's coming from your heart. So there's a lot of examples of that. There are different kinds of pain. So as a physical therapist in PT school, we learn about different kinds of pain. And so, for example, with muscular pain, somebody might describe it as achy. They might have pain with certain positions or with too much movement or not enough movement. They usually are able to change their pain with changing their position, or heat or ice or some pain medication. On the other hand, if you look at like nerve pain, that tends to be described by people as like a sharp and shooting pain. They might experience like numbness or tingling as well. So the way that you describe your pain to your physical therapist will give them a lot of information, as well as, your medical history, your activity level, all that kind of stuff. So we can figure out what's going on and how we can fix it. For somebody who has chronic pain, there's a lot of information usually because a lot more time has passed. So there's a lot of stuff that might be going into that chronic pain situation. So, for example, if you started off with a car accident and after that, you had a lot of anxiety about driving, you also, were in too much pain to start going to the gym. So then you got weak. And so now you're having back pain, which is triggered by sitting for too long or, walking. So there's a lot of the history, especially with chronic pain, that needs to be dissected to figure out what information is valuable and what information is just kind of not relevant in order to figure out what's going on. For some people, when they go see, let's say, a specialist, and the specialist says, there's nothing wrong on your x-ray, or, all your images look normal, that doesn't necessarily mean that there's nothing wrong, especially just because there's no physical injury. Like, the way that you're moving has a lot to do with the pain that you might be experiencing, or the way that you're not moving. For some conditions, let's say you fracture your leg, you do want to not move, right? So when you see a physical therapist, they should be able to point you in the direction of who you need to see if the physical therapist feels that it's not something that can be treated by a physical therapist, like a musculoskeletal injury or even a nerve injury. If they think that, you would benefit from surgery or from seeing a specialist like a cardiologist, because they're not sure, the shoulder pain that you're having doesn't really sound like shoulder pain. It kind of sounds like you're having a heart attack. They might refer you to the ER. So a physical therapist is a good place to start, but it's also a good place to go if you've already been kind of everywhere else and haven't been getting the answers that you've been searching for. The things that I just wanted to clarify is a lot of times people think that, like, if there's nothing on their imaging, or someone tells you that the pain is in your brain or it's in your head, they really aren't saying that the pain does not exist. What they're saying is that the pain that you're experiencing is really a signal from your body. And some people have pain and no injury, and some people have an injury and no pain. So sometimes pain or severity of pain is not always equal to the severity of the injury that you have. The nervous system plays a really, really important role in your body's interpretation of pain in the moment, and also like in future situations. So a lot of times with chronic pain, that kind of gets tied into the pain experience. But if you're feeling pain, whether that's acute pain or chronic pain, seeing a physical therapist can be very, very helpful to figure out what's going on in your body and what the best thing to do to hopefully reduce it or make it go away completely. For some people with chronic pain, the goal might not be zero pain. It might be less pain or less frequent pain, which is an improvement. But for a lot of people, you can reduce or eliminate your pain if you do the appropriate things to address what's causing that pain. Whether that's addressing the nervous system hypersensitivity, or addressing mobility restrictions, strength limitations, whatever the case is, and hopefully get you back to doing whatever you want to do so that you have a happy and healthy life. So let me know if you have any questions about pain or physical therapy or anything else, and I'll see you next time.